Thank you so much for that lovely introduction, and to Dr. Barrett and his team for having me today. It's such a pleasure to be here, and I feel like I've learned so much from all of you already, and hoping that I can share a little bit of this topic, about this topic, through my lens. And so I wanted to just start out by talking a little bit about my specific lens. So as you heard, I'm a clinical psychologist by training. That means that I do some research, some clinical work, and some teaching as well. And I actually started out working at the VA system in Boston in September of 2001, right before 9/11. And this work that I'm going to be presenting today is really work that grew out of my own clinical experiences. So it was work that grew out of my sitting with many veterans of many eras and listening to their stories. And so it's very important to me to have their voices come through in the presentation that I'm going to do today. So I'm going to have some volunteers read voices of the veterans who have shared with me in this work. And this work is incredibly humbling, and feel like I learned a tremendous amount through the veterans. So hopefully you'll hear some of their voices today. So I wanted to say that as they were coming back and as we were progressing after 9/11 deeper and deeper into the wars, one thing that we were doing in the PTSD clinics was really providing evidence-based psychotherapies for PTSD. And one thing that I noticed is that even after many of the veterans shared their stories and went through these psychotherapies, there was still something missing, and they were asking very profound questions. And so things like, do I deserve to be happy after killing? How can I continue to have a spiritual life after what I did? Why do I deserve to have a child if I took someone else's child away? And these really were questions that didn't fit into the paradigm of how we were conceptualizing PTSD and how we were treating PTSD. And I think that was really the motivation for me to try and understand this at a much deeper level. I felt like we needed to do better, and we needed to provide better treatments and understand this at a much deeper level. And so what I began doing is, I think that there's a very rich history in ethics and philosophy with many of the spiritual communities. There's readings about that chaplains turn to, and people of many different denominations. And so there was a rich literature there, but really in terms of the psychological and psychiatric literature, when I looked to see what was there about the impact of killing in war, at the time there was really very little out there. And so that to me was a big motivator to try and do more and learn more so we could best help the veterans who are coming back and struggling with these issues. And the theme that really emerged to me was that while we were trying to treat with our PTSD treatments what happened to people and what they experienced, it was also very important to turn to listening to what they did and how they suffered because of what they did. And so that's really what brought me to studying the impact of killing. At that very same time, as I was thinking about this, Dan Baum wrote a New Yorker piece, and it was really influential in terms of my thinking. It called out veterans, hospitals, and other people who treat veterans about not dealing directly with the treatment of the impact of killing in war. So all these things kind of came together, and this is when I knew I wanted to look at this at a much deeper level. So since then, I moved to the San Francisco VA and UCSF, and so that's really where I began to delve deeper into this issue. Okay, so I wanted to just present a little bit of what I'm going to be talking about today. Ed was kind enough to also provide me some questions that came up during the seminar, so I tried to incorporate a lot of those questions into the work that I'm going to be talking about today. So I wanted to start out because particularly of my interest in killing in war and the impact of killing in war, I wanted to start out with some research that does exist and the work that we have done. I wanted to also focus on the focus groups that we did. So as I mentioned, there was very little out there when we started, so we wanted to start from the ground up. And so we met with veterans of many different eras, and we had focus groups and had them talk directly in their words about how killing impacted them. And I want to say here, because I think that this is a topic that was raised in many different talks, so not everyone who kills in war has moral injury or develops moral injury. And I think that the group that I'm talking about here is really who we see coming to us and wanting help around this topic. And so it's a smaller group that develops moral distress, and that's who I'm going to be focusing on today. So I'm going to start with talking about killing, and then I'm going to broaden the lens and talk about moral injury as a whole. And I'm going to spend some time on a really important topic to me, which is moral injury and suicide. And then I'll sort of end by talking about one example of how we treat moral injury clinically and how that might be different from PTSD treatments overall. So it's ambitious, but I'm hoping to get to all of that today. So what we know in terms of how many people actually kill in war, we know that about 77 to 87% of those who served in Iraq infantrymen reported directing fire at the enemy from this study by Hogue, and about half of those reported being responsible for the death of an enemy combatant. Now, you can kill directly or you can feel responsible for the death of someone in many different ways, and so half of people reported being responsible for the death of an enemy combatant, and about 14 to 28% reported being responsible for the death of a non-combatant. The numbers are actually quite similar when you look at the Vietnam era as well. And so there's some consistency across eras. So what was very important to us in trying to delve deeper into the topic of does killing impact a number of mental health outcomes, we wanted to understand that relationship, but we also wanted to understand that that relationship wasn't just due to being in combat. So statistically, we were able to manipulate that. And what we found in, over a number of different studies, so we looked at Iraq veterans, we also looked at Gulf War and Vietnam veterans, and overall, and I'm happy to provide anyone who's interested with these studies, but what we found was that veterans across multiple eras who killed in war were at higher risk for PTSD, alcohol abuse, suicide, and functional difficulties after returning home. So again, not everyone who's going to kill is going to develop these problems, but it puts you at higher risk. So the other thing that we really learned quite quickly is that killing is not routinely assessed by the VA. And you can see here that there's sort of the group with the worst symptoms, the group that didn't have very high symptoms, and then there's two intermediate groups, one with high avoidance and emotional numbing, and one with lower avoidance and emotional numbing. And so what we found is 75% of the veterans who killed were actually in the two worse off PTSD groups. So we knew that we were onto something, and we wanted to look at this in much greater detail. So as I mentioned, when we first started doing this work, we wanted to really let the veterans tell us themes that emerged through these focus groups. And I think that we also, I'll later talk about, we use these focus groups to be able to try to categorize different cognitions that people have as a result of killing in war. So I'm going to ask for some audience participation at this point. And so one theme that emerged was the dark side of the self. So I'm just going to have people volunteer to read the different squares. So please raise your hands and I'll kind of, otherwise I'm going to call on people. Okay. Yeah.
What squares are you talking
Oh
about?
yeah, so just, oh sorry.
Oh.
That helps, okay.
I'm not a mind reader.
Okay, yes, that's right. I'm sorry, my slides here don't match there, so that's a good reminder that I have to, there we go, okay.
Seeing the dark side of the self.
Good, okay, so next person.
You kind of feel like a monster. What am I capable of doing is what scares me.
Thank you. Please just feel free to jump in.
It kind of brings into mind the question of who you are as a person and what you're capable of. It brings a lot of insecurity.
Callous reaction to death.
Okay, thank you. So I think this was really the first theme that emerged, and as you can see here, it's really what emerged over and over again was that veterans felt like they saw the dark side of the selves, and that they really couldn't go back after seeing this. And so the word monster came up quite a bit, and just the idea that you can see what you're capable of, and that other people who haven't fought in war don't have to see that side of themselves. And so it really brings a lot of insecurity, was a theme that emerged, that this was something that just brought a lot of insecurity for people because of having it, not being able to kind of merge who they felt like they were before and who they were after they had killed in war. And this idea of a callous reaction to death came up quite a bit as well. And so I'm going to return to this a little bit later on, but just that after exposure, after multiple exposures to death, that there was kind of a numbness that developed through being exposed to death over and over again. So, and this really, the dark side of the self, or seeing the dark side of the self, veterans drew a direct relationship between that and self-esteem, or how they saw themselves. Okay, so the next theme that emerged was secrecy and stigma, a sense of the fact that you really couldn't share and tell what you had experienced, because if you did, people would judge you. And as someone else pointed out earlier today, that if you were sitting at the dinner table, even though people asked, they really didn't want to know. And so it put the veteran in a bind about knowing and really trusting that when people asked, they wanted to hear, and also just feeling like that they would be judged. So it was a no-win situation about whether or not to share this or not. And that was difficult, because I think for a lot of people, what emerged was a sense that they could talk about what happened to them, but they couldn't talk about what they did, because that was something that they had to take with them to the grave. And so that it wasn't okay somehow to talk about this with other people, or even in therapy. And actually, when we ran these focus groups, some people shared with us for the very first time they were talking about their killing experiences, just because they felt like people were asking, so now it was okay to talk about it, but that before it wasn't okay to bring that up. So I think that's important too. So I'm going to ask people to read once again the voice of the veterans. So please feel free to jump in.
You can't speak it out because you don't know who you're going to talk to. What's going to happen if you let your emotions or feelings out?
Great, thank you.
I always thought that if I talked about some of those things, that people on the street would think that I was completely crazy. And that was reinforced because the media, crazy Vietnam vets, they're baby killers. It was better not to tell anybody.
Thank you.
I know they wanted to ask me that question, especially my father. But you know, from the look on his face, he wants to know. And at the same time, I read in his face that he's kind of scared of what I've done.
Nice, thank you.
Putting it on the back burner.
Great, thank you. And so again, this idea that even though you wanted sometimes to talk about it and get it off your chest, that it was something that you just kind of kept pushing off and saying to yourself, okay, well, eventually I'm going to talk about this, but now is not really the right time. And I think what was very interesting to me when I first started doing this work was I was getting a lot of calls about veterans at the end of their lives. And so this topic was coming up, and they wanted to talk about it at the end of their lives as they were either in hospice or thinking that the end of their life was near. And so my argument here is that I think we need to be talking about this sooner and not have a situation in which people are waiting to the very last minute. I think one of the speakers, David Lubon, brought up the point that we have to, by putting it out there and talking about it, that's how we make sense of things. And if people are really waiting to the last minute to do that, they don't get to integrate that in the same kind of way that will help them move forward with what they experience. And so I think a big piece of this is also about who you are as a person and fitting the pieces of what you did with your other experiences. So your war experiences with being, a mother or a father, and someone who is in a particular job. So all of those things need to be integrated. And if we don't talk about them, then people will never have the chance to really do that. So I think that that's critical. Okay, so this is the last theme that I'm going to share with you, and very relevant to this conference of morality. So please feel free to jump in. I think this is a really important one.
Your morality gets tossed out the window. Same thing with religion, because I think once you start thinking about it, boy, I can't do this because this is against everything I've been taught or believed in since I was a young person. When you start thinking about the moral issue, you'll be dead. You don't have time to think about those things. Just do it.
Thank you. Yeah, so this idea that again, there's no time to think, so you just do, and then the thinking comes afterwards. And that's when some of the moral distress comes up for people. Okay, next volunteer.
But then you have to come back and you have to think about that later on and what you're responsible for. And that's very hard. That comes back to haunt me all the time.
Yeah, and that was another big theme that came up, this idea that of haunting, and that these images and these memories continue to haunt people. And not in the same way that PTSD did, but at kind of at the moral level. It was a moral haunting. So, okay, last but not least.
I think you feel ashamed of what you did. You
know, you're trained to do that and it just stays with you. I guess I feel very sad sometimes. I feel proud to be a soldier and try to do something that I thought was right for the country, but it's hard to be a soldier. It tears away from your moral fiber. It changes your life.
Thank you. Thanks for all the volunteers for reading. And I think the idea here is, again, that your life is changed, and the moral fibers in particular, I think that's a nice way to put it. It tears away at your moral fibers. So there's a disintegration that temporarily that happens as a result of struggling with these moral issues. So I also just want to make a distinction here between the shame and the guilt. So the shame here is about who you are. So it's a conflict that happens because of how you experience yourself, whereas guilt is more about what you did from the way that I conceptualize it. Shame is more about who you are. And so I think here we're really hearing a lot about how what you had to do in war changed who you are, at least the perception of who you are. And so I think that that's really an important component of this as well. So I want to just highlight too the complexity of this issue around morality. So I worked with someone who was a medic, and so he felt that going into this, his job would be to save people, and really felt strongly about that role and what he was doing. And during the course of war, he had to kill another person. And for him, it just didn't fit together. And he really struggled with that and how to integrate those two pieces of what he did during his war experience, and how one just really didn't fit into the other. So we worked for a long time so that he would be able to understand that even though this is what he did, it's not who he is. And so I really want to kind of stress the separation between those two things here. Okay, I think that I want, in the spirit of sort of having veterans' voices here, I wanted to show you a clip by Korangal by Sebastian Younger. This is, I think, highlights one of the inherent struggles that veterans face. I think a lot of good points are made in this small clip, so I'm going to just show that to you right now. We can talk a little bit about it in a second.
For a while there, I started really thinking that God hates me. And like I said, I'm not religious or anything, but I felt like there was this hate for me because I did sins, I sinned. And although I would have done it the same way, everything the same exact way, I still would feel this way, and that's a terrible thing of war. You do terrible things, then you have to live with them afterwards, but you would do them the same way if you had to go back. So what do? It's like it's an evil, evil, evil thing inside your body. It's like fucking good versus evil inside there. And everyone tells you, you did an honorable thing. You did all right. You're all right. You did what you had to do. And I just hate that comment. Did what you had to do. Because I didn't have to do any of it. And that's what the fucking thing is. That's the hardest thing to deal with. I didn't have to do shit. I didn't have to go to an army. I didn't have to become airborne infantry. I didn't have to do any of that. But I did, and that comment, you did what you had to do, just drives me insane. Because is that what God's going to say? You did what you had to do. Good job. Punch you on the shoulder and fucking say, welcome to heaven. I don't think so.
So I think that this highlights a really important issue. There's so many poignant things about this clip, but I think one of them is trying to explain away moral injury or the line that was sometimes crossed for people. And so, for him, he felt like he had sinned or he had done something wrong. And what he was reacting to is people trying to explain it away, like you did what you had to do. And I think here, what's important is the difference between sort of challenging how people think or feel about things and accepting that that's where they're at. And so I'm going to return to this point, talk a little bit more about it later on, but But I think it's a critical piece here that sometimes what happens is that veterans that I've seen in clinical practice will perceive that rather than deal with the gravity of what they're bringing to the table, there's a whitewashing or trying to explain away or making them feel better. And they actually want to sit with the gravity of what happened and work through it. And I think that that's a really important piece of what we can do, both in clinical practice as well as this is a critical point for clergy and for the religious and spiritual community where they come in as well. And it's they've been doing this for many, many years. And so it's just listening and being there so that people can work it through and not explain it away. So the next piece that I'm going to want to talk about here is how are killing trauma and PTSD trauma different? So I know this was a question that came up in the seminar, and I think it's, I really want to highlight the pieces here that I think are critical. So with PTSD trauma, what we think about is violence from the violence from the other directed at the self. And with killing trauma, it's really violence from the self directed at the other. So these are two very different things. With PTSD trauma, as we heard already, it's a very fear-based response to trauma. That's what's most typical. That's what a lot of the treatments are based on, the fear-based response. So we expose people to the fear and the hope that they'll habituate to it. With killing trauma, the emotions are quite complex. So there's a fear component. There's also, people might have lost people who were near and dear to them. They might have experienced anger during the killing. There might have been a wide range of emotions, and all of those are important actually in dealing with moral injury in clinical practice. With PTSD trauma, oftentimes the person is a recipient of the trauma. They might feel helpless, and they're trying to self-protect, whereas with killing trauma, you're a participant, you're activated, and oftentimes there can be moral conflict as a result of that. So I want to sort of the definition that has been read before, but I think it's worth a refresher here, that this is from our 2009 paper, and again, I'm very much focused on self-directed moral injury. So here it's broadening the lens just a little bit, moving past killing and making the lens a little bit bigger, perpetrating, failing to prevent, or bearing witness to acts that transgress deeply held moral beliefs and expectations. And in order for moral injury to occur, there has to be some kind of a transgression that happens. And so I would also argue that I conceptualize moral injury on a continuum. And so at one end of the continuum might be sort of a more intense moral injury, but then there's also moral distress. And we heard a lot of other perspectives today on what that continuum might look like. And so rather than something that's distinct, you have one or you don't, I would urge us to think about this on a sort of much broader continuum. So I wanted to put up, at the same 2009 article had a preliminary causal framework, and I think it's worth walking through this because it actually is how I think about the treatment of moral injury clinically. So, so the first piece of that is the transgression that I talked about. So there has to be some perceived crossing of a line. That's about either personal or shared crossing of a line. And that causes some dissonance for the person. And then there are a number of ways in which they're thinking about that. So there's attributions that they're making. So for example, I don't deserve to be happy, I don't deserve to have a family. So there's ways in which they're conceptualizing what happened to them in the aftermath of that. There's shame, guilt, and anxiety that follows, a sense of withdrawal that we talked about. And then this is the piece that actually makes us different from PTSD treatments and is actually, in my eyes, critical. So there's a failure to forgive and to self-forgive, and a condemnation that happens. That failure to self-forgive then leads to, unfortunately, suicide and a number of other functional difficulties. So again, you imagine that if you feel that you took another child's life and you don't deserve to have one of your own, that's going to impact your ability to have a family, to be intimate with someone, to start a relationship, and we can just imagine the functional difficulties that can happen. For a lot of people, it's not only about those functional difficulties, but there's also a self-harming behavior that occurs. And I'm not only talking about suicide, but there are people who will drink or use drugs to self-harm in that way as well. And so for some people, it's a much more prolonged experience. And really causes problems down the line. So this is really the causal framework that I'm going to use when I talk a little bit later on about treating moral injury in particular. So I'm going to show you another brief clip here, and if we broaden the lens from PTSD to moral injury, this clip talks about the differences, but it also talks about why typical treatments for PTSD might not be sufficient to treat moral injury. And so this is from a documentary called Almost Sunrise, and it's a very, very short clip.
Standard PTSD mental health therapies and drugs don't work is that those drugs and therapies are really directed towards reducing fear. And so much of suffering that veterans are going through is more about guilt and about shame and thinking about whether what they did while deployed was right or whether it was wrong. And so that's inherently, a moral dilemma.
Okay, thank you. Okay, good. So I think another question that came up in the seminar is how are PTSD and moral injury different in particular? So we talked about the differences between PTSD trauma and killing trauma. Now I'm going to focus and hone in on PTSD versus moral injury. So PTSD is a diagnosis, and so it's in the DSM-5, and there's very particular symptoms that you have to meet in order to get a diagnosis. So there has to be a traumatic exposure and a host of symptoms. And so for the DSM-5, which is a slight change from the DSM-4, you have to have some re-experiencing symptoms. So that includes things like nightmares, images of and reminders of what happened to you. There has to be some avoidance, so you don't want to talk about it, you don't want to think about it. Try to avoid anything that reminds you of the trauma that happened to you. There's an emotional numbing that happens, so things that you used to be able to experience, like love and happiness, you might not be able to experience anymore, or those experiences might be quite dulled. So negative thoughts or feelings, some of which we talked about, so it's how you're thinking about and perceiving yourself, the world, other people. And finally, arousal. So these are symptoms like insomnia, being easily startled, having hyperarousal. So those have to be true in order for people to meet a PTSD diagnosis. And as we mentioned before, treatment for PTSD is really grounded in a fear-based approach. So now when we think about moral injury, it's much more of a dimensional issue. So again, thinking about it on a continuum, and it involves necessarily spirituality. And I mean spirituality really in the broadest term. So for some people, that's about religion. For other people, they see it in a very different way. So whatever that means to the person is what I'm talking about here. And moral injury is also about the sense of self, as I talked about before, and integrating the sense of self. So exposure is not sufficient with moral injury. There needs to be a perceived transgression. And often, as we talked about, it involves a functional component. So self-sabotaging behaviors and other things that can occur. And in moral injury, again, involves spirituality. There has to be a process to heal that involves self-forgiveness. And also I'm going to talk a little bit more later about making amends. I'm trying as hard as I can to talk through the background noise, so hopefully you guys are able to stick with me here. Okay, so now I want to transition into a topic that's actually very important to me on a personal level. I want to share with you some of the story of Noah Pierce. Some of you might be familiar with him. The first time I heard about his story was in a documentary called War Torn. You can tell I watch a lot of documentaries. And so Noah Pierce was someone who served 2 tours in Iraq. He's someone who served once in 2003 and another tour in 2005. He wrote home a lot about some of the things that he experienced, and through his letters you could really hear about some of the moral dilemmas that he experienced, and he was exposed to a lot of death and dying and killing, and was really tortured by those experiences. And so when he got home, and his mother tried to be as supportive as possible, his community also, but he turned to alcohol to try to really numb out some of those feelings. And unfortunately, a few years after he returned, ended up taking his own life. And I think it was a profound loss of someone who was a very incredible young man who was dealing with a lot. And so I wanted to share with you because this really, when I heard about this in the documentary, it really weighed quite heavily on me because of the very clear connection he makes between killing and taking his own life. So this was from his suicide note. Mom, I am so sorry. My life has been hell since March 2003 when I was part of the Iraq invasion. I'm freeing myself from the desert once and for all. I'm not a good person. I have done bad things. I have taken lives. Now it's time to take mine. So I think that this, again, really highlights for him the struggle that he became what he actually did, and he felt that he killed, and then it was time to turn the gun on himself. And I think that this is a really important thing for us to be studying. With really the epidemic of suicide that we're experiencing right now, we have to try to understand better how we can help people. And I think this is one of the keys that's been under-discussed. And I really am hoping that we can do more so we can understand the direct link between moral injury and suicide. One of the papers that we published was actually looking at veterans who had killed, and what we found in 2012, these were veterans who had served in Vietnam. So those who had higher killing experiences actually had twice the likelihood of suicidal ideation compared to those who didn't, and who had lower experiences. And that's even after we take into account the PTSD that they might be experiencing, the depression, any substance, and any combat exposure. So really showing that there's a direct relationship here and that we have to be thinking about this in a lot more detail. Okay, so I want to try and offer one theory to understand the relationship between killing and suicide. I'm going to talk you through this, but this is called the interpersonal psychological theory of suicide. Some of you might be familiar with this, by Thomas Joyner. And the idea here is that 3 conditions have to be available in order for someone to take their own lives. So there's this idea that the first condition is thwarted belongingness. And so we already saw from some of the focus groups that if you feel stigmatized and you feel like you don't belong, for a lot of people, they felt truly like they belonged as part of their unit, and they felt like they were doing a common mission. Then they have a homecoming where they feel very isolated and alone, and for many people feel like they don't have that same support and community when they return back. And so this idea of thwarted belongingness, I think, is a very profound one, and is definitely something that we hear a lot about when veterans come back. The other one condition that's important is perceived burdensomeness. And so the idea here is that you feel like you're a liability. And Noah Pierce was actually an example of this. He felt like he was causing a burden to his family by being alive. And so it's this idea that you're a liability and that the world would be better off without you, so that belief that people might hold to be true. And so the last piece is acquired capability. And so the idea here is that there has to be a knowledge and about how to take your own life. And so for a lot of our veterans who go to war, they know how to kill, they've been trained in that. And so it's not a difficult thing to then have the means available to turn the gun in on themselves. And so all of those 3 conditions have to be available. And if you're suffering in these ways, then for a lot of people, that can help explain why they take their own lives. It sheds some light about also how we can intervene. So making sure people don't feel alone, like a liability, feeling like they have a sense of community. And that community is really about not only the veteran community and the military community, but whatever, their families and the larger community. And we've heard a lot about how there needs to be more community participation in the healing process, and I fully believe that as well. Okay, so I want to there's a lot to discuss here, but I wanted to just put up a few ideas about how moral injury and ethics can impact us. And so some ethical issues that arise in war that can appear in treatment. So again, these are ones that come up quite frequently. So we've heard about a few of these. So shooting a child who poses a life threat, right? So of course, if someone is threatening your life, you are going to fight back, but then that poses a dilemma if you hold certain ideas and certain morals and values, and those are going to come into conflict. So not being able to correctly identify the enemy, saving someone who's considered a terrorist. And so for a lot of the veterans, especially the medics that we work with, one dilemma that they had is that they were out there in war, and the enemy was actually brought to them to take care of it. For them, they clearly were helping save the enemy, but it also created just a conflict for them as well, and what that meant, and who they couldn't save because they were saving that person, and so they talked about those struggles. So killing someone in war who's suffering and has a low odds of survival, this is another thing. Medics are folks that we actually see quite frequently. You can sort of see why from some of these examples. So making a call if someone is suffering profoundly, and sometimes in war you have to make that quite quickly about putting someone out of their pain and what that might mean if someone had to do that. And it continues to trouble people because they always question whether or not they made the right decision. So these are the kinds of decisions that people are needing to make in war and struggling with in the aftermath. Not trusting that command is acting ethically and receiving orders that go against morals and values, both of those we've heard about today. Okay, so now how do we treat moral injury? So as we mentioned before, PTSD treatments are grounded in fear-based theories, so we have to go beyond that in treating moral injury. So we have to go beyond treating moral injury and acting like it's a mental health diagnosis. And in fact, I think one of the things that I get asked about is, should moral injury be in the DSM? And I actually think that that it shouldn't, because of some of the reasons that we mentioned beforehand. That it's really about working across disciplines to try and help our veterans, and that sometimes the very fact that they're struggling with these issues is not a sign of mental illness or a problem, but something that we professionals have to help them with, their families have to help them with, and the community at large has to help with. So we don't see it as a mental health problem, but rather something that we all need to work towards helping our veterans in healing. Okay, so this is a very, very important point to me, and why I'm really honored to be here today. I think that I'm very aware that clinicians cannot solve this on our own. We're in a very humbled positions getting to hear about people's stories, and they trust us enough to share in a safe environment that we create, but we can't do this alone, nor should we ever feel like we need to do this alone. I think that what's really important with this topic is building the bridges, and so learning and hearing from philosophers, from ethicists, from spiritual leaders, from families, from cultural communities. We all have to work together to do this, and so this is a bridge from where I'm from, but there are lots of different bridges that we can really build in helping solve this issue and helping veterans heal from this. So I think that a lot of programs that I've heard about. So, for example, several VAs are now doing programs where they have groups and that are co-led by chaplains and by psychologists or by another mental health professional. And I think it's about that cross collaboration, because we're each going to bring a unique aspect to the treatment and in the healing. And so I think that what I've thought a lot about as I've been listening to the talks today is what an important role that ethics and ethicists have in this, and really thinking about how we can work together to bring some of what you all are thinking about here into the treatment very directly. And I think that there's a huge role for that, and I'd like to continue thinking and talking about that. So I think that there's so many lessons from the last 2 days that have been learned here, and I want us to continue to think about how we can take that and use it to help people collectively. Okay, so another topic that came up was in the seminars, can therapists treat moral injury? And as I've kind of mentioned, I think that it's really, we have to do this as a community, but here are some things, so I wrote yes, but I think these are some of the things that are very important. So I think as therapists, we have to be very clear about our relationship to spirituality and be aware of how that can create some bias. And we also have to be very clear about our role, that we can explore spiritual conflict, but we are not spiritual counselors, nor should that ever be our role. And so the chaplains in the spiritual community are people who can act in that fashion, but that's not a therapist role. So I want to make that distinction. I think it's a very important one. So again, we can bring things out into the open, we can talk about conflicts, but not be spiritual counselors. So understanding that a part of the healing is actually the therapist being a witness to what's happening. So as we talked about before, a lot of what happens is for many people taken to the grave. And so recognizing that for a lot of people, just telling their stories and putting the pieces together and creating that tapestry of what happened to them, and maybe there's things that they've forgotten about, some of the context that they've left out, that's actually healing in and of itself. And then being witnessed by someone who's not judging you but really hearing is a very important part of the healing as well, from my perspective. Understanding that everyone has a dark side, so that's critical. We heard that in the focus groups, and understanding that when we ask our military personnel to go to war, we're exposing them, as we've heard about from many speakers today, some of the things that most civilians will never get to experience or have to grapple with. And so if we don't understand that everyone has a dark side, then we're doing our veterans a disservice. And I want to end this with, I think, a very poignant quote by Tyler Boudreau. So when we talk about moral injury, we seek a deeper understanding of our humanity. We seek healing in some spiritual sense. So again, this idea that by just talking about moral injury, it's a way in which we can all be connected and understand humanity at a very much at a deeper level. And I think that in just talking about virtue and so many of the things that we all must grapple with as humans, I think it's a way to connect all of the dots together. Okay, so the final thing that I'm going to focus on is, very briefly, is actually the one particular treatment that we've worked on, which is the impact of killing treatment. So as I mentioned before, there are groups now that treat moral injury. My colleague Brett Litz is working on a treatment called adaptive disclosure. And so there's so much to talk about here, but today I'm going to focus about our own work that is called IOK, or the impact of killing, and just share with you some of the ways in which our thinking has been shaped in providing treatment for veterans. So the idea with the impact of killing treatment that was very closely developed through consultation with colleagues, particularly Chris Bergman is someone who I work with, who's a psychologist who I work with very closely, but this was developed through the focus groups, through consultation with professionals from many different disciplines, and also just through our own work. And so this is a treatment that actually follows traditional PTSD treatment. So it's we conceptualize it as a treatment that builds on what we currently have in our clinics. Okay, so how is the impact of killing treatment different than traditional treatments? And so first, I think that in terms of the cognitions that we talk about with PTSD that were raised, so a lot of the cognitive behavioral theories that are out there, and the particular cognitions such as I don't deserve to be happy or have different things in life. So I think that those cognitions, some of those cognitions need to be challenged and others accepted, just like we talked about a little bit with the film clip that I showed you all. So most traditional CBT therapy is focused on challenging faulty cognitions, and here we're expanding the lens by saying actually we believe that it's very important to distinguish between what needs to be challenged and what needs to be accepted. The second piece that IOK is different from traditional PTSD treatments is that we deal very directly with spiritual and moral concerns, so those are brought to the table and grappled with. Self-forgiveness is a key piece of that, and I'm going to share with you a little bit about how we deal with self-forgiveness. And we do something that is tailored letter writing that I'll also describe, but it's, we heard a little bit about it, but in IOK what we do is we actually have the person write a letter to the person who they killed or harmed very directly, and that doesn't happen in a vacuum, and I think that that's very important. We build up to that, so I think it's actually can in some cases be harmful to just do that if you're not in the right support system, but we do that, we sort of build up to that task. And then another piece is we talk very explicitly about connection and making amends. So we heard about earlier today about how just talking about self-forgiveness isn't going to be enough. And so I think taking the next step and thinking with particular veterans about how do you make amends that fit for you in your own life is important. And then finally, this is a critical piece, is that we see this treatment as a catalyst rather than a resolution, so, and very much present it that way. So this is a springboard to start talking about these issues, and that hopefully you plan to see that will continue to grow. I'm under no illusion that self-forgiveness is a process that can happen quickly, and so really it's planting the seeds that can grow with family, with community, wherever people feel safe in doing that. So, okay, I'm going to talk a little bit about challenge versus acceptance, and how you make how you really decide about whether something needs to be challenged or accepted in clinical practice. And so here are just some guidelines, but I think if you're going to challenge something, there has to be a recognition that the context is not complete, so you don't have the whole story, that the person is honing in on one very specific aspect rather than broadening the lens to what happened. So as you talk about the more complete picture, your perception of what happened can change drastically. And so, so really filling in the pieces and broadening the lens is important. If you hear that there's black and white thinking rather than a recognition of the gray and the nuance, that's another area of that you might want to challenge. And then if you're feeling confused due to an incomplete story, that's another way in which you want to broaden the lens and understand what's going on. So areas of acceptance, if there was a line that was crossed and someone is sharing that with you, I think that that's an important thing to identify and work on acceptance rather than challenging that. As we all know, it's very important to be direct in this line of work and not try to whitewash or pretend like something didn't happen or try to erase it or make people feel better. I think you have to be present with what actually happened and honor that. So I think especially acceptance is very important when the event is based in a firm grounding of what happened, and that when the event needs to be integrated rather than understood through a different lens. So just some guidelines about how to make those distinctions. So I'm just going to share very briefly with you that we did a randomized controlled trial of this impact of killing protocol. We included 33 combat veterans. They were pretty wide range of ages, and we started out by doing 6 to 8 sessions, and then we actually expanded it to 10, and I'll be sharing with you sort of that 10-session outline. I'm not going to have a ton of time to go into that, but I'll just start the conversation and put it up there for you to see. So I know we started a little bit late. How much time do I have? It will depend on how quickly I go. So we're at the end, but I just want to know exactly how much time I have.
Yeah, 5 more minutes.
5 more minutes.
We can do
Perfect.
5 minutes of Q&A.
Okay, perfect. Yeah, and like I said, I'm pretty much at the end here. So this is the 10-session outline. I'm not gonna go through the whole thing, but I wanna highlight a few key pieces here. So, we start out by talking about common responses to killing. So again, this is specifically focused about the impact of killing and feeling responsible for the death of another person. We talk about, we use what's called the killing cognition scale, which I'm going to share with you in just a moment. That was built through the focus groups, and by highlighting different cognitions that people experience that could be causing functional impairment. And so we look at where a person is having the most difficulty. And so this treatment is tailored to that, and that's a very important component. We work on areas of acceptance versus challenging, like I talked about just now. And then forgiveness is a major part of this treatment as well. So we start out by actually asking the person how they define self-forgiveness. Where do they get those ideas about self-forgiveness, or where do those ideas come from, and what does it mean to them? So we have them write about those things so we can, because for every person that's different, so we've worked with people from a variety of religious backgrounds. We've also worked with Native American veterans, and so for each person, they're going to have a very different idea about self-forgiveness depending on what background they're from and what cultural heritage they're from and what spiritual heritage they're from. And so we also talk about what are the barriers to self-forgiveness. So for a lot of people, there's a very strong belief that to forgive is to forget. And so we really work on beliefs that come up like that around if you forgive yourself doesn't necessarily mean you're going to forget. And we know that that's not true because these moral injuries can stay with people for a lifetime even if they work on forgiving themselves. So, so really working up the barriers to self-forgiveness and putting those, just highlighting what those are for each person. And then we talk about the function of self-forgiveness. So what would it mean to the person to start to think about self-forgiveness? And then finally, we get to writing the letter. So you can see there are multiple steps. It's not just done in a vacuum, but we really build up to it. And so then we ask them to specifically to write a letter to the person that they killed. I'm actually going to share with you that some of the details of this have been changed to protect the identity of the person, but I wanted to just share with you an example of what that looks like. I'm just going to ask for a volunteer to read it. If you don't mind, I can ask you to read it.
Sure. Okay.
Thanks.
Let me just stand right here.
Yeah, that would be great.
Dear X, I don't know your name, but I'm sure you had one. I have no idea how to start a letter like this, other than to just come out with it. I am sorry for how I treated you. I know you understand that we had to kill to stay alive in war, and you probably would have killed me if you had the chance. But I know I scared you, taunted you, and made your last few moments on earth painful, and I was cruel. I am so sorry for that. I know this doesn't excuse what I did, but I need you to know that to me, you're one of them. And after we found Joe like that, I just wanted you all dead. I could see the disgust in your eyes when you looked at me, and it only fueled my rage. My rage for being in Vietnam, my rage for being shot at every day, for losing men I would have died for having to walk through bodies on a daily basis. And yet, you probably felt the same way. You were a kid, probably younger than I was. Did you hate me? Or did you just hate the war we were both stuck in? The miserable waste of human life? Did you have a family? Probably. I'm sorry that you never saw them again, and I wonder if you thought of them before you died. I wonder how they must have felt when they found out you were dead. Maybe you lost friends too. Please know that I am not the type of person who wants others to suffer. I will regret forever how I treated you. But I am not that man, that kid, that scared, angry, lost kid who is so pissed and sad and fed up with all of this war and took it out on you. I hope you know that I think about you and your family all the time. I hope you can understand that I forgive you too. I forgive the kids caught in a fight that I didn't think was theirs. I hope you have found peace, and I hope I can too.
Thank you so much for reading that. So I think this just highlights, again, the power that writing to someone can have, and just really putting it out on the table. And this is the kind of work that can come out of creating an environment where someone trusts you enough to share this with you. And I think veterans who have done this, written these letters, have brought them back to groups that they're involved with and shared. And so I think it's, again, that this kind of healing can also be shared with other veterans who can then grow from that as well. So there's a lot there in the letter, but just in the interest of time, I'm going to just share some of the cognitions that arose and that we asked veterans about in the impact of killing treatment. So, here are some examples of guilt, shame, self-blame, loss of meaning, remorse and regret, moral violation. So I'm happy to also make this available to other people because I know we don't have a lot of time left, but these are some of the things that we work with very directly in this treatment. So I'm going to skip through some of this. I'm just going to share, I thought that this was, some of you might be familiar with Margaret Holmgren. I think that this is I don't have a lot of time to talk about self-forgiveness, but the person who habitually works towards a state of genuine self-forgiveness exhibits an important virtue. She recognizes her own intrinsic worth, which she retains in spite of her wrongdoing. And that, to me, really exemplifies what we're trying to do here, the process that we're trying to start. So, okay, so finally, I'm going to just skip to kind of my last point here, which is the road ahead. And this is just questions that I want to pose to the audience and that we can continue thinking about together. So hopefully we've started a dialogue that can continue. So from your perspective, how can we continue to build bridges between ethicists, clinicians, and the spiritual community in healing from moral injury? There are many other disciplines that can actually help as well. And so what are some of the ethical gaps in understanding of moral injury? And finally, how can ethics be more fully integrated into moral injury clinical work? And so I think that that's some of the thoughts that I want to leave you with today. Thanks for being so attentive, despite this being the last presentation. And I know this is a heavy topic, so I want to just take a few moments to give people a moment to breathe, and then we can just jump right into questions. So thank you. Just put up my huge thank you slide, and then my email as well, in case people want to contact me. So.
Yeah. So for all the midshipmen here, we're training to be young second lieutenants and ensigns in the Navy Marine Corps, and we're going to be leading young sailors and Marines who are liable to incur a moral injury at some point during their career while we're leading them. So I know we're not training to be clinicians or doctors or therapists, but we might be the first person they're able to talk to when that happens. So what role should that young officer play in helping mitigate the effects of that moral injury? If it's not the treatment, what can we do to help with that?
Great question, thank you. I think one of the key things is actually recognizing when someone is struggling and needs help. And so I think it's actually a huge service to just listen sometimes and then know, what maybe the limitations of what you can do are, right? So I think even just listening to a person can be a huge help. And then, knowing that there's a chaplain or someone in behavioral health that you can refer the person to if they really need more help. But sometimes the incredible thing is that just talking to other people and having someone to listen can actually help tremendously. So as I kind of talked about, sometimes if you catch the problem early and the person feels like they're not alone, that can go a long way in helping them heal. So by being just open to that experience, I think you can go a really long way.
Dr. Maguen, very, very thorough presentation. Really appreciate it. I have twofold questions. First of all, I notice a lot of the stats that you provide and the individuals that you work with in the VA tend to be troops that were engaged in ground combat, especially folks in the front units. What has been your experience or the experience of your colleagues dealing with individuals who may not have been boots on the ground, but let's say like your aviators, folks that work in air ordnance that loaded the bombs, or we think about that sailor that fired the Tomahawk missile, or anyone in the supporting role, or how about the folks that are flying drones? What has been your experience or the experience of your colleagues dealing with that type of moral injury and killing?
Thank you. Was there another question?
And the other one, maybe twofold for anyone to answer. So my other question, as I was listening to this whole presentations throughout the past 2 days here, how do we reconcile moral and military virtues and moral injury with conflicts that do not appear to meet at vulnerable just war criteria? Seeing that, it depends who you ask. And sometimes I look at past conflicts that we've had after Vietnam, between Vietnam and the Iraqi freedom. When you look at previous wars like World War II, World War I, we had a whole slew of allies that were with us. But you look at maybe the last conflict where it's been like, we don't agree with this, you're on your own. How do we reconcile that?
Yeah.
I'm sorry, I didn't mean to make it so complex.
No, that's great. We'll see, and clearly this is a big question that could use a lot of input from different people. But The first question, so we do deal with a lot of folks who have had boots on the ground, but we actually deal with a wide range. So we deal with many different, combat roles and many different, including support roles, so not only boots on the ground. So Army, Navy, Marines, we kind of see the wide range of people who come to us because we're open to any veterans that have issues and want to come talk to us, and so and including pilots and drone pilots as well. So we kind of see the range of those, and so I think the issues are unique, and part of that as a clinician is being culturally competent, so knowing the differences between the branches and knowing what kind of roles people served in, and so and there's a huge discussion. Cultural competence actually is can be a topic onto itself, I think, but I think it's really understanding that as a clinician and working with the person, whatever their issue is and whatever branch they come from, and those issues are all going to be different. So as you can tell, a big part of being able to treat this is being able to tailor the work, and so we have to understand not only what branch someone is from, but also their cultural background and their spiritual background. So there's a lot of factors of diversity that need to be integrated. And then your second question, I think we could also probably spend a whole hour on, but I think what's very important to me is that when people are coming to me to sort of grapple with some of these issues, is that I'm a sounding board or a springboard for which they actually can get into the details of some of the topics that you were bringing up and really kind of struggle with those in an accepting and open environment. And so I think that's key for me. That's sort of the perspective. So I'm not there to sort of make judgment or to sort of break apart the bits and pieces of that, but I'm there to sort of listen, integrate, and help them integrate so that they can feel like they can move on with their lives from a point of having difficulty functioning to a point where they're reconnecting with